For more than 30 years, doctors have studied one silent killer that takes the lives of over 52,000 Americans every year. But here's the shocking truth: most of those deaths could have been prevented. Because this disease often gives clear warning signs months, sometimes years, before diagnosis. Yet millions of people ignore them. Today, I'm going to reveal the most important early warning signs of colon cancer after age 60, the subtle signals your body sends long before the disease becomes life-threatening. And one of these signs is so common that many people experience it for years without realizing what it means. Let's start with one of the earliest changes most people overlook. A sudden shift in your normal bathroom routine. If your bowel movements suddenly become more frequent, or far less frequent, and this change lasts longer than 2 weeks, your colon may be trying to warn you. Tumors growing inside the colon can disrupt the natural movement of waste through your digestive system. Sometimes they slow everything down, causing persistent constipation. Other times they irritate the intestinal lining and trigger repeated diarrhea. But here's what many people miss: it's not the change itself that matters. It's the persistence. If your normal pattern suddenly changes and doesn't return to normal, your doctor needs to investigate. And the next warning sign is even easier to notice, yet still ignored by thousands of people every year. Pay attention to the shape of your stool. If bowel movements start appearing unusually thin, like pencils or ribbons, this can indicate something blocking part of the colon. As a tumor grows, it narrows the pathway stool must pass through. The result? Stool becomes noticeably thinner. While an occasional thin stool is usually harmless, consistently narrow stools for several days or weeks should never be ignored. But the next warning sign is the one doctors say people dismiss the most, and it can be extremely dangerous to ignore. Blood in the stool. This might appear as bright red streaks, dark maroon coloring, or sometimes blood that isn't visible at all but shows up during medical testing. Many people assume bleeding is simply caused by hemorrhoids. And sometimes that's true. But here's the critical point doctors emphasize: after age 60, any unexplained rectal bleeding should always be evaluated. Because colon tumors often bleed when stool passes across their fragile blood vessels. And ignoring this sign can delay diagnosis for months. Now here's another symptom that often develops slowly. Persistent abdominal discomfort. This may feel like cramping, pressure, or pain in one specific area of the abdomen that keeps returning. Early tumors rarely cause pain. But as they grow larger, they may partially block the colon or stretch the intestinal wall. When this happens, the body responds with repeated cramping as it tries to push waste past the obstruction. If abdominal pain appears frequently in the same location for several weeks, doctors recommend getting it checked. But the next warning sign doesn't always appear in the digestive system at all. Instead, it shows up in your energy levels. Many colon cancer patients first notice something doctors call unexplained fatigue. They feel constantly tired, weak, or short of breath, even after rest. Often this happens because slow internal bleeding from a tumor gradually causes iron deficiency anemia. When the body loses iron over time, it produces fewer healthy red blood cells. And without enough oxygen circulating through the body, fatigue becomes overwhelming. But here's another symptom that people rarely connect to colon cancer. Feeling like you still need to use the bathroom even after finishing a bowel movement. This persistent sensation happens when a tumor in the lower colon or rectum creates pressure that the body mistakes for stool. The brain keeps receiving signals that the bowel isn't empty. so people feel the urge to go repeatedly, even when there's nothing left to pass. If this sensation happens frequently, doctors call it tenesmus, and it should always be evaluated. Now here's a symptom that many people consider a good thing, but can actually be a serious warning sign. Unintentional weight loss. If you lose more than 5 pounds in a single month without dieting or exercising, your body may be fighting something internally. Cancer cells consume large amounts of energy and can also suppress appetite. This combination can cause rapid, unexplained weight loss. And the final warning sign doctors emphasize involves something that isn't a symptom at all, but dramatically increases your risk. Family history. If a parent or sibling had colon cancer, your risk increases significantly. Doctors recommend earlier, more frequent screenings in these cases. Remember, early detection boosts the survival rate above 90%. Delayed diagnosis leads to lower survival rates. Recognizing warning signs and acting quickly can save your life. If you're over 60 with persistent digestive changes, fatigue, or bleeding, don't wait. Talk to your doctor about screening. Early detection makes treatment easier and can be life-saving.